When was the last time you woke up with rock-solid morning wood? If you can't remember, or it's been months or even years, your body is trying to tell you something critical about your health. Here's what most men don't know. Morning erections aren't just about sex. They're actually your body's way of testing your circulation and nerve health while you sleep. When they disappear, it's often the first warning sign of bigger problems coming down the road. But here's the good news. Stay with me for the next few minutes, because I'm going to show you a simple 10-minute evening routine that can bring back those automatic morning responses in just 7 days. And you can start tonight, right before bed, using nothing but your own hands and a few simple adjustments. Gentlemen, I'm Dr. Grace Miller, a urologist with over 2 decades of experience helping seniors restore their vitality. And today, I'm going to reveal why your bedtime habits are destroying your morning firmness and exactly how to fix it starting tonight. No pills, no devices, no embarrassing doctor visits, just a proven evening routine that works with your body's natural overnight repair systems. By the end of this video, you'll know the exact steps to take before bed, the science behind why this works so fast, and what to expect each morning over the next 7 days. But first, you need to understand why morning wood matters so much. Because once you know what it really means, you'll realize this isn't just about sex. It's about your overall health and longevity. Think of your body like a well-designed machine. For everything to work properly down there, 3 systems need to communicate perfectly. Your brain sends the right signals during sleep. Your blood needs to flow freely and powerfully, and your entire pelvic system needs to respond automatically. Morning wood, medically called nocturnal penile tumescence, is not a result of sexual arousal or having dreams about sex. Instead, it's a normal function of the male reproductive system. In fact, regular episodes of morning erections are a sign that the nerves and blood supply to the penis are healthy. Here's what happens as we age, and this is critical to understand. The frequency and duration of nocturnal erections decrease progressively with age. In contrast to younger men, the majority of men above age 60 do not have full nighttime erections, even though they and their partners reported regular sexual activity. If a male does not have morning erections regularly, it can indicate a health issue, such as erectile dysfunction, which involves having trouble getting or keeping an erection. Not having regular morning wood can also suggest problems with the nerves or the blood supply to the male reproductive organs. This is why getting your morning erections back isn't just about bedroom performance. It's an early warning system for your overall circulation and cardiovascular health. Your penis is actually one of the first places that blood flow problems show up. Here's something most men don't know, and it's absolutely critical. The position you sleep in directly affects your ability to have nighttime and morning erections. Let me explain why this matters so much. Sleeping on your stomach compresses the penis under the body's weight, restricting blood flow and potentially leading to symptoms such as fatigue and impaired function. When you sleep face down, you're literally crushing the blood vessels and nerves that need to work properly for nighttime erections. Sleeping on your left side can compress the heart and restrict blood flow to the genitals, potentially leading to erectile problems over time due to inadequate circulation. Even sleeping on the right side can compress the testicles and penis between the legs, putting more pressure on them compared to when standing. So what's the best sleeping position? The best sleeping position for men is lying on your back with your legs naturally spread apart. The internal organs in the chest cavity and reproductive organs are not compressed, avoiding reduced blood circulation. This position allows natural blood flow throughout the night and gives your body the best chance to produce those healthy nighttime erections. All right. Here's your exact step-by-step routine to do tonight before bed. This entire process takes about 10 minutes, and each step builds on the previous one to create the perfect conditions for rock-solid morning wood. Step 1. Optimal sleep position setup, 2 minutes. Before you even get into bed, you need to set yourself up for success. First, make sure your bedroom temperature is between 65 and 68 degrees Fahrenheit. Quality sleep supports hormonal balance and blood vessel health that's essential for proper circulation. Keep your bedroom cool, completely dark, and as quiet as possible. This cooler temperature is crucial because your body needs to lower its core temperature to enter deep sleep, and deep sleep is when the magic happens. Now, when you get into bed, lie flat on your back. Place a thin pillow under your knees to take pressure off your lower back and keep your legs naturally separated, about shoulder width apart. Don't cross your legs, don't roll onto your side, just relax on your back with your arms at your sides or resting comfortably on your chest. This position ensures unrestricted blood flow to your pelvic region all night long. Step 2. The pelvic circulation massage. 3 minutes. While lying on your back, you're going to perform a simple massage that dramatically increases blood flow to your entire pelvic region right before sleep. Remember that perineum massage I taught you in a previous video? This is the perfect time to do it. Place your index and middle finger on your perineum, that spot between your scrotum and back passage. Apply firm, steady pressure and make slow circular motions. Clockwise for 30 seconds, then counterclockwise for 30 seconds. You should feel warmth spreading through the area. Now, take your hands and place them on your lower abdomen, just above your pubic bone. Using both hands, make slow, firm circular motions, pressing gently but firmly into your lower belly. Do this for 1 full minute. You're massaging the area right above your bladder and prostate, encouraging blood flow to the entire region. Finally, take one hand and gently massage the base of your penis and testicles for about 60 seconds. Not roughly, just gentle, encouraging touch that brings awareness and circulation to the area. This sends signals to your nervous system that this region is important and needs good overnight blood flow. Step 3. The deep breathing technique. 3 minutes. Nocturnal erections occur during REM sleep when there is a shift from sympathetic nervous system stimulation, which is fight and flight, to parasympathetic stimulation, which is rest and digest. This shift in balance drives the parasympathetic nerve response that results in erection. Here's how to activate your parasympathetic nervous system before sleep using a proven breathing technique. Still lying on your back, place one hand on your chest and one hand on your belly. Close your eyes and breathe slowly and deeply through your nose for a count of 4. Hold that breath for a count of 4, then exhale slowly through your mouth for a count of 6. The key is making your exhale longer than your inhale. This signals your body to shift into rest and digest mode, the exact mode you need for nighttime erections. Repeat this breathing pattern 10 times. It should take about 3 minutes total. You'll feel your entire body relaxing, your heart rate slowing, and a sense of calm washing over you. Step 4. The evening hydration strategy. 1 minute. This might surprise you, but proper hydration timing is crucial for morning wood. About 2 hours before bed, drink a full glass of water, about 8 to 12 ounces. This ensures your blood maintains good viscosity, meaning it flows easily throughout the night. But here's the important part. Stop drinking water about 90 minutes before bed. This gives your body time to process that water, so you're not waking up multiple times to urinate, which disrupts the deep sleep you need for nighttime erections. Men without physiological erectile dysfunction experience nocturnal penile tumescence usually 3 to 5 times during a period of sleep, typically during rapid eye movement sleep. If you're constantly waking up to use the bathroom, you're interrupting those crucial REM cycles. Step 5. The mental visualization. 1 minute. The final step is mental preparation, and this is more powerful than most men realize. While still lying on your back, eyes closed, breathing slowly, visualize yourself waking up tomorrow morning with a strong, firm erection. Don't just think about it, actually feel it in your body. Imagine that sensation of fullness, that automatic response, that confidence. Your brain doesn't know the difference between a vivid visualization and reality. By creating this mental image before sleep, you're priming your nervous system to make it happen. Spend 1 full minute on this visualization, really feeling it as if it's already true. Then release the thought, take one final deep breath, and allow yourself to drift into sleep, still on your back, in that optimal position. Now let me be completely honest with you about realistic expectations, because I want you to know exactly what to anticipate each day. Days 1 to 2, you might not notice dramatic changes yet, but your body is already responding. You're sleeping in a better position, your circulation is improving, and your nervous system is starting to shift. Some men report feeling more rested and noticing increased warmth in their pelvic region in the mornings. Days 3 to 4. This is when most men start noticing the first signs of returning morning firmness. It might not be a full erection yet, but you'll likely wake up with some degree of tumescence or fullness that you haven't felt in a while. This is your body remembering what it's supposed to do. Days 5 to 6. By the end of the first week, the majority of men report noticeable improvements. Morning wood is returning with more consistency and strength. You might wake up with a firm erection that lasts several minutes, something you haven't experienced regularly in months or years. Day 7 and beyond. After 1 full week of this routine, most men experience significant restoration of morning erections. They're waking up with reliable firmness. And more importantly, this is translating to better performance during the day and evening as well. Remember, your body needs consistency. Missing a night here and there won't destroy your progress. But the more consistent you are with this routine, the faster and more dramatic your results will be. Once you've mastered the basic routine, here are some additional tips to amplify your results even further. First, avoid alcohol within 4 hours of bedtime. Alcohol might make you sleepy, but it destroys sleep quality and dramatically reduces nighttime erections. If you're going to drink, finish well before dinner. Second, avoid heavy meals within 3 hours of bedtime. When your body is working hard to digest a large meal, it diverts blood flow away from your extremities, including your penis, and toward your digestive system. Eat your last substantial meal by 6 or 7 p.m. if you're going to bed at 10 p.m. Third, turn off all screens at least 1 hour before bed. Set up a bedtime routine including putting screens away 1 to 2 hours before sleep and avoiding caffeine after 2 p.m. The blue light from phones, tablets, and TVs suppresses melatonin production and disrupts your natural sleep cycles, including the REM sleep where erections occur. Fourth, consider wearing loose, breathable underwear to bed, or better yet, sleep without underwear at all. Tight clothing restricts circulation and increases temperature in your genital area, both of which negatively impact nighttime erections. This before-bed routine works even better when combined with the other techniques I've taught you. Remember that morning coffee enhancement with circulation-boosting spices? That's working during the day. The perineum massage is working throughout the day. And now this evening routine is optimizing your nighttime circulation. You're creating a complete 24-hour system for restoring and maintaining healthy erectile function. Morning nutrition, daytime circulation support, and evening optimization all working together. Also, if you're not already doing some form of daily movement, add a 20 to 30-minute walk to your routine. Penile blood flow peaks during maximal tumescence, and both penile blood flow and musculovascular events increase during REM sleep. Regular physical activity throughout the day sets you up for better nighttime circulation. Now I need to give you some critical safety information. First, if you have any diagnosed sleep disorders like sleep apnea, you absolutely need to address that with your doctor. Research has shown that people with obstructive sleep apnea who used continuous positive airway pressure devices had more frequent nocturnal erections than those who did not. Sleep apnea destroys sleep quality and directly impacts your ability to have nighttime erections. Second, if you're taking any medications, especially blood pressure medications or antidepressants, be aware that some of these can affect morning wood. Don't stop taking prescribed medications, but do talk to your doctor about alternatives if this is a persistent problem. Third, depression in men is associated with a potentially reversible decrease in erectile capacity and diminished nocturnal erections. If you're dealing with depression or severe anxiety, address that with professional help. Your mental health directly impacts your physical sexual function. Fourth, this routine is not a substitute for medical treatment if you have serious health conditions. If you have diabetes, cardiovascular disease, or other significant health issues, work with your doctor while implementing these natural approaches. Let me explain exactly why this routine works so powerfully. Testosterone, which is at its highest level in the morning, has been shown to enhance the frequency of nocturnal erections. By optimizing your sleep quality and duration, you're allowing your body to produce optimal testosterone during those deep sleep stages. Sleep-related erections have been reported to occur from intrauterine life to senescence. It has been speculated that the main function of nocturnal erections is to provide adequate engorgement of the corpora cavernosa, which then leads to increased tissue oxygenation. This prevents cavernous fibrosis, which is probably the most common cause of organic erectile dysfunction. In other words, regular nighttime erections aren't just about performance, they're about keeping your penis healthy at the tissue level. The increased oxygen from nighttime blood flow prevents scar tissue formation that makes erections progressively more difficult. When you sleep on your back with unrestricted circulation, practice the pelvic massage to increase blood flow. Use deep breathing to activate your parasympathetic nervous system and create optimal sleep conditions. You're giving your body every possible advantage to produce those healthy, tissue-preserving nighttime erections. Here's exactly what I want you to do, starting tonight. Commit to this complete before-bed routine every single night for the next 7 days. Tonight, day 1. Set up your bedroom for optimal sleep temperature. 65 to 68 degrees. 2 hours before bed, drink your water. 1 hour before bed, turn off all screens. Then perform the complete routine: sleep position, pelvic massage, deep breathing, visualization. Days 2 to 4. Repeat the exact routine every night. Pay attention to how you feel when you wake up. Note any changes in morning firmness, even subtle ones. Write them down so you can track your progress. Days 5 to 7. Continue the routine with confidence, knowing your body is responding. By day 7, evaluate your results honestly. Compare how you're waking up now versus how you were waking up a week ago. Most men are genuinely amazed at how quickly their body responds when given the right conditions. After 7 days, this should become a permanent part of your evening routine, just like brushing your teeth. Gentlemen, you don't have to accept the loss of morning wood as a normal part of aging. Regular episodes of nocturnal penile tumescence are a sign that the nerves and blood supply to the penis are healthy. When those morning erections disappear, your body is trying to tell you something important. This simple 10-minute evening routine addresses every factor that affects nighttime erections. Optimal sleep position for unrestricted blood flow. Pelvic massage to increase circulation. Deep breathing to activate your rest and digest nervous system. Proper hydration timing. And mental preparation to prime your body for success. It takes 10 minutes before bed. It requires no equipment, no supplements, no expensive treatments. And it can restore the automatic morning responses you thought were gone forever. So tonight, before you go to bed, take those 10 minutes, follow every step, lie on your back with your legs comfortably apart, let your body do what it's designed to do during sleep. Your body still remembers how to produce rock-solid morning wood. Sometimes it just needs the right conditions and a little reminder of what it's capable of. If this information has been helpful, I want you to do 3 things right now. First, give this video a thumbs up so more men can discover this natural approach to restoring morning wood. Second, Subscribe and hit that notification bell because I share practical health strategies like this regularly. And third, I genuinely want to hear from you. Drop a comment and let me know what time you typically go to bed and whether you've noticed any changes in your morning firmness lately. And if you commit to this 7-day challenge, come back next week and share your results. Your experience could inspire another man to take that first step. Remember, taking care of your intimate health is taking care of your overall health and longevity. Every step you take toward better circulation and stronger nighttime erections pays off in ways you'll notice throughout your entire day, not just in the bedroom. I'll see you in the next video, where I'll share even more natural ways to maintain your vitality and performance as you age. Until then, take excellent care of yourself and get ready for some impressive mornings ahead. You deserve to feel confident and energized at any age.